$150 per hour. If you're having two people paying you at the same time, but you're not splitting your treatment, then you're making $300 an hour. If you're a physical therapist and you are working for a week in an outpatient clinic and you're getting paid weekly, right? You're probably getting paid somewhere around $1,000 every week, something like that, right? If you're running a cash pay clinic, I think the minimum amount of money that physical therapists should charge for an hour of their time is $150. If I started a cash pay clinic tomorrow in a major city, I would charge about $300 for an eval and $150 to $200 per hour of time that I was with each individual patient. And the way I would set up my clinic, if it was just me in my clinic, you guys, and this is how I treat people, I would stagger my appointments. So I would have patients come in every half an hour. So one patient would come in, aside from the eval, if these were just regular visits, a patient would come in, I would put needles into them, I'd put them in a room, I'd put my music on them, put the red light therapy on them, and I would leave them there for the needles to sit in, because I like to leave the needles in for about 30 to 45 minutes, or a little bit longer sometimes, if I can. So while one person is relaxing in a room with needles in, I would go start another patient, the other patient with needles. So I would not be actually splitting my time between people ever, but I would be getting paid by two people at the same time. So I would put needles in one person, I would put them in a room, I would have another patient come in, I would put needles in them, and then I would go back to the first patient. I would do my manual therapy and my manipulations. They would leave. I'd go back to the other patient. I'd do my manual therapy and my manipulations. They would leave, and I'd just do that process over and over again all day. So if you were charging $150 per treatment session, which again, I think is the minimum that people should charge. I have friends of mine that are totally packed for years out, you guys, that are charging $250 in cities like Philadelphia and Boston and stuff like that. $150 per hour. If you're having two people paying you at the same time, but you're not splitting your treatment, then you're making $300 an hour. The average physical therapist is making like $300 a day. So just think about that for a second, you guys. As a cash pay clinician, you can literally treat two people a day. So you could work for 2 hours a day and make the equivalent amount of money if you worked 1 hour a day and you had two patients, right, that were split between that hour, so look, you would be making $300 for that hour. That's the same amount of money that you're making in 8 hours working for somebody else with insurance.